Hi there. Welcome everyone to our ATS Critical Care Assembly Fireside Chat. It's a pleasure to welcome everyone in today. My name is Priscilla Dela Cruz. I'm going to be our host for today. It is a pleasure for us to welcome Dr. Wesley Ely. Dr. Ely is a critical care pulmonologist and professor of medicine at Vanderbilt University Medical Center, where he cares for critically ill patients in the ICU and leads innovative team-based research. He is the Grant W. Little Chair in Medicine and co-director of the Center for Critical Illness, Brain Dysfunction, and Survivorship. Dr. Ely's work has reshaped how we understand delirium critical illness and its long-term cognitive, psychological, and functional consequences, including links to Alzheimer's disease and related dementias. His research spans critical care, geriatrics, neurology, psychology, and public health, making it a powerful example of team science in action. Trained at Tulane, Wake Forest, and Washington University, Dr. Ely has spent his career building collaborative teams that translate into bedside observations into lasting improvements in patient outcomes. We're excited to learn from his insights on team science and how early career professionals can thrive in collaborative and interdisciplinary environments. Please join me in welcoming Dr. Wes Ely. Thank you so much for being here, Dr. Ely.
Thank you, Dr. De La Cruz. I appreciate the opportunity to be with you in the audience, and I'm going to be, I'm sure, edified by your questions and happy to share whatever is of your interest.
Thank you. To get us started, can you take us back to early in your training? What initially drew you to critical care and to the questions that have shaped your career?
Sure, I remember I trained at Tulane in Charity Hospital, and I remember being in a medical ICU with a patient, and she was dying of postpartum cardiomyopathy, and I was holding her hand and there with her, turning her dopamine drips up and down, trying to keep her out of shock. And as we formed a relationship, she looking in my eyes, me looking in her eyes, it was so intimate. And at the same time, I knew that I couldn't get her out of this demise. We had no cure for her at the time. And eventually, when I was holding her hand, she coded, and I saw the terror in her eyes, the fear. I was a medical student, so the team swooped in, took over the code, and I watched her die. And it was at that moment that I thought to myself, I want to do this and do it better and do more.